Childhood diseases characterized by rash are called exanthems. First disease aka measles. Second disease aka scarlet fever. Third disease rubella. Fifth disease aka erythema infectiosum. Sixth disease aka roseola infantum, ecanthema subitum. Microorganisms causing measles and its genetic material. Paramyxoviridae ssRNA virus. Incubation as well as infective period of measles. Incubation 8 to 12 days. Infective 4 days before and 5 days after of rash. Mode of spread and secondary attack rate of measles. Droplets, and 90%. Stages of clinical features in measles. Prodromal stage 1 to 3 day. Exanthem 2 to 3 day. Exanthematous phase 4 to 8 day. Prodromal stage of measles. Fever 3C cough coryza conjunctivitis. Exanthem phase of measles. Koplik spots characteristic. White spots surrounded by reddish hue, second molar lower. Rice grain, sand grain appearance. Exanthematous phase of measles. Maculopapular rash, starting behind ear, move down to trunk. Leave brown pigmentation. Increase fever after rash. Complications of measles. Acute. 1. Otitis media MC. 2. Pneumonia. Chronic. SSPE, subacute sclerosing panencephalitis. SSPE features, when they appear, diagnosis and management. When 7 to 13 years after measles infection. Features, myoclonic seizure, cognitive impair EM-net, personality changes. Diagnosis, Ig anti-measles antibody in CSF. Management, fatal condition. Causative microorganisms of scarlet fever and toxin. GRPA bet hemolytic streptococci. Toxin pyrogenic exotoxin. Age group for scarlet fever. 5 to 15 years. Clinical features of scarlet fever. Fever, sore throat, anterior cervical lymph node tenderness. Strawberry tongue. Rash of scarlet fever. STRTS on second day. Sandpaper rash. Spares palm and sole. Accentuate at skin crease. Scarlet fever rash accentuates at skin creases, this is called postia lines. Post-streptococcus complication in scarlet fever. 1. Acute rheumatic fever. 2. Post-streptococci glomerulonephritis. 3. Post-streptococcus arthritis. Investigation and treatment of scarlet fever. Throat swab culture. Oral penicillin V greater than amoxicillin. Rubella is aka German measles. Third day disease. Causative microorganisms of rubella. Togavirus, ssRNA. Incubation and infective period of rubella. Incubation 11 to 21 days. Infective 5 days before and 6 days after onset of rash. Clinical features of rubella. 1. Rash, on day 1, start behind ear, downward, no discoloration afterwards. 2. Forchheimer spots, tiny rose lesion in oropharynx. 3. Lymphadenopathy. Lymphadenopathy in rubella. Suboccipital, posterior auricular, and cervical. Complications of rubella. 1. Post-infectious thrombocytopenia. 2. Arthritis. 3. PRP progressive rubella panencephalitis. Causative microorganisms of erythema infectiosum. Parvovirus B19, ssDNA virus. Incubation period of erythema infectiosum. 4 to 28 days. Rash and its progression in erythema infectiosum. Slapped cheek appearance, then rash move to trunk, then central clearing of rash lacy reticulated appearance. Associations of erythema infectiosum. 1. Erythralgia. 2. Transient aplastic crisis in pre-existing hemolytic anemia. Roseola infantum, subitum causative microorganisms. Human herpes virus 6 greater than 7. Echovirus 16. Roseola infantum features. Fever. Rash on day 4. Maculopapular rash. Starts in trunk. Decrease fever after rash. No residual pigmentation. Specific spots seen in Roseola infantum. Nagayama spots. Erythematous macules in soft palate and uvula. HFMD causative agent and age of kids. Coxsackie 16, enterovirus 71. In preschool kids. HFMD features. First manifestation, blisters around mouth. Papulovesicular lesion in sole and palm. Direct fomites mode of infection. Chickenpox causative microorganisms. Varicella zoster virus, dsDNA virus. Incubation period of chickenpox. 10 to 21 days. Infective period in chickenpox until when child should be isolated. 24 to 48 hour. Should be isolated till all existing lesion have crusted. Rash of chickenpox appear on day 2 of fever. Appearance of chickenpox rash. Dewdrop on a rose petal. Progression of chickenpox rash. Macule to papule to vesicle classical. Pruritic. Starts in trunks. Leave behind hypo or hyperpigment macule. Pleomorphic appearance. Complications of chickenpox. 1. Secondary bacaterial infection on skin. 2. Cerebral ataxia. 3. Meningoencephalitis. 4. Reyes syndrome, aspirin usage and varicella. Lesion scrapping in chickenpox for diagnosis method. Sank smear. Drugs in chickenpox. Acyclovir, paracetamol. Avoid ibuprofen. Live attenuated varicella vaccine is made up of strain. Oca.